Hello there, and thank you for staying tuned to Sunrise at Sea right here on CTV. Welcome to another episode of Wellness, and I am back at the hospital, the Kampala Hospital, and with me is Dr. Ntambi Charles, and today we're going to be discussing diabetes. So if you haven't yet followed us on social media, please head on to our social media on Facebook, Twitter, and Instagram, and that's at CTV Uganda. Like, share, subscribe, or if you miss any episodes of Sunrise at Sea, you can rewatch this episode on our YouTube channel, and that's at CTV Uganda. So good morning, doctor, and thank you for joining me again.
Good morning once again. I know, just as a reminder, you should also get to know that we are running a chronic care campaign.
Yes.
And when somebody says diabetes, you know that is chronic care.
Yes.
So I've asked something very interesting, diabetes.
Yes.
I think this goes around, the common man calls it sukari, others call it sugar. So the scientific name is diabetes.
Yes.
Yeah, so...
but is diabetes largely caused by just, high levels of sugar in the body? Many people wouldn't even don't understand how diabetes comes along. Yeah. You say it is chronic. Is it hereditary, or can somebody later contract it in their life?
Okay, so once again, thank you. So diabetes, it is associated with high sugar levels in blood.
All right.
That is the whole basis of diabetes, when you have a lot of sugar in your blood. So this can be acute. Okay. If you have ingested a lot of sugar, a lot of fizzy drinks, soda, they might run a test and the sugar is high. But as much as the sugar is high, there is even a limit for high sugar in your body. What we call the expected normal limit, even when the sugar is high, it means the body is able to control the sugars.
Yes.
And the reason why some people call it chronic, your ability to control sugar usually reduces with time. And chronic means something more than six weeks in most cases. In medicine, other people say after 1 month. And then we have some standard diagnoses for chronic disease, which might be a bit shorter for such conditions. So it is chronic because usually for you to have poor control, it takes some time. Initially, people have very good control. But there are exceptions where somebody is born and they're unable to control sugar right from the word go.
Okay.
That is at birth.
Is it hereditary, or it's a medical?
Yeah, there is a genetic predisposition.
Yes.
For one, if your mother or father or grandfather had problems with diabetes, you also have problems with diabetes.
All right. So
there's always a genetic component in disease to a greater extent, but usually for you to have the manifestation of the two types of disease, where you have the primary diabetes and the secondary diabetes, the primary one is also very hereditary in its sense. So in the primary diabetes, this is where you have a person. It is associated with, some people were able to differentiate them. Initially, we used to call them insulin dependent and non-insulin dependent.
All right.
So there is a certain part of your body that produces insulin, and that is the pancreas.
What is insulin? Insulin
is a hormone, and this hormone helps regulate. It's one of the hormones. It's one of the chemicals, I would call them chemicals, released by your body.
All right.
That allow you to control sugar
in the blood.
In the blood.
Yes.
So it affects how sugar is taken up and how your sugar is utilized in your body.
So how can somebody monitor their sugar?
So we have
the sugar levels in the body.
We have other tests, common tests. These are bedside tests, self-tests. I think for those ones who have been with relatives who have been on insulin, which is one of the chemicals I've told you that is used, it's a hormone to control sugars. You have to test, we call it a random blood sugar.
Okay.
Sugar is in your blood, so we test the sugar in your blood, and we have our normal ranges using the machines that you might be having, the calibrated machines.
Yes.
Ideally, these are measured in millimoles, and you're looking at the higher and lower limit. Usually the lower limit is 3.5 in a normal patient, and for some patients who are on anti-diabetic medications, we don't want them to even reach the 3.5. You'd want them to be in the 4.5, a safe zone. And depending also on the calibration of the labs you're using, some people have 6.5, others have 7 as the upper limit.
Yes.
But then others also have a cutoff of 11, despite whether you have eaten something or had a sugary intake. Usually we don't expect your sugar levels to go beyond 11
All right.
millimoles.
So let's talk about symptoms. How does somebody know that they may be or possibly have diabetes?
Yeah, so diabetes is a multi-system disease. People are studying diabetes and still studying diabetes. So if we are to talk about it, we can talk until
the cows come home,
yes. So, but off head, what should you do? If you are feeling sick, any feeling weak, general weakness, headache, urinating a lot, any sickness, make it a custom to always know your sugar whenever you enter any hospital or any health care facility.
All right.
Because it's just a prick. And from that prick, we can always know whether your sugar is high or low. The other signs and symptoms, these might be subtle, but with time, the problem is the sugar is also a very bad disease. Apart from the acute sugar, where you have very low sugar,
yes,
you will feel dizzy, you will feel weak because you don't have the fuel to make you run, so you might collapse.
Okay.
That's if you have very low sugar. But when you have a very high sugar, it is more detrimental. It takes time and it keeps on destroying other cells.
Oh, wow.
And you just get to know the side effects of having high blood sugar. So usually high blood sugar can affect your eyes, your kidneys, your liver, your skin, your sexual function, all those things. It is a multisystemic disease and it slowly eats away. People who have wounds that are not healing, you could be having high blood sugar.
Okay.
People who are having unexplained eye problems, you could be having diabetes. People who are having heart problems, high blood pressure, because the two move together, sugar and fat. So they could be clogging your vessels and damaging your vessels, and this could. So generally, I encourage anyone that has any form of disease, whether acute or chronic disease, because usually also diabetes presents with chronic disease. You may be having a cancer, and with time you develop. The most recent was COVID, when we were seeing COVID patients become diabetic at the end of it. They may have healed from the COVID, but they become now diabetic. So basically, any derangement of your systems can predispose you to diabetes. And in its sense, I usually tell people, diabetes is a body which is no longer under control. Because ideally sugar is good for the body, but it should be under control. But if the body can no longer control it, you become diabetic.
All right.
Whether high or low.
Okay. And then lastly, how can one prevent themselves from getting diabetes? You know, just besides the people who are already born with it, because they are put on insulin. You already mentioned that. So how can we prevent ourselves from getting diabetes?
Thank you once again. So you have hit the nail where it's supposed to be hit.
Yes.
Prevention. So in disease, I keep on telling people, prevention, prevention, prevention. In most cases, like we had earlier communicated, our body is a vehicle.
Yes.
And it has a mileage. You can take it far if you take good care of it, and you will not get far if you do not take good care of it. So what we eat, what we drink, the cosmetics we use, all these run to your what? To your organs.
Yes.
They run to your blood, and once you start having bad, we call them bad radicals, because most of these dangerous things, the bad cosmetics, most of the skin lightening agents, the alcohol, drugs that people are taking, whether illicit drugs, whether undocumented herbal drugs, don't forget that also, herbal medications that are not documented. Then the foods we are eating, if you do not have good recollection of the food sources, these are going into your body and they're stressing your body. If your body is under stress, it dysregulates. If it is dysregulates, it means you're at high risk of your pancreas, which produces the insulin, to stop working as effectively. People who have a high dietary intake of sugary intakes, it means as much as your body or any food, it should not only be sugar. Sugar is in almost everything that we eat.
Okay.
The cabbage, the potato, the monde for our local people, the rice, the normal foods that we eat. Only that in some of those foods it's a bit low compared to the fizzy drinks and the processed sugars.
Yes.
You get a very high shot of sugar in very low quantity. So generally I advise a healthy eating habit, a balanced diet. Balance, balance, balance. One of the take homes is balance, balance, balance. Balanced diet, balanced lifestyle with exercise, balanced lifestyle with also good knowledge of what you are doing. Don't try to do things at the extremes.
Yes.
Balance your life and you balance your sugars.
All right.
And you prevent diabetes.
All right, thank you so much, Dr. Ntambi Charles. And you heard it from the doctor, balance your life. Do not self-medicate also. So always just have a good balance to your life with your health and with your lifestyle, because if you do not pay attention to your health now, you're going to be forced to pay attention to your illness a lot later, and nobody wants that. Well, that is all I had for you on this segment of Wellness, and thank you for staying tuned to Sunrise at Sea. Don't go away because we still have a great show lined up for you. Don't blink.